Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining us right here today on another edition of Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information in the world of natural living. Today, I am so happy to have right in studio with us, right here live, Dr. Stephen Goldstein. Dr. Goldstein has been a chiropractor in Lynbrook, New York for over 35 years. His practice focuses on treating patients from the womb to the tomb, as he says, in other words, any age, utilizing chiropractics, advanced allergy therapeutics, and nutrition response testing. And he incorporates many other varied techniques, which we'll talk about today, such as applied kinesiology, Sacral Occipital Technique, and Activator and Directional non-force technique, DNFT. And he recently added cold laser therapy and pulsed magnetic field therapy. Dr. Goldstein is also a Freemason for over 30 years and has served as Master of Guiding Light Olympia Lodge in Baldwin 4 times. And we're going to bring him right on board so he can talk about all his projects, such as teaching meditation and all the community events that he's involved in. So thank you so much for joining us today, Dr. Stephen Goldstein.
Thanks for having me. I really appreciate it.
And we'll tell our people that we can find Dr. Goldstein right here on Long Island at goldspinechiropractic.com. And we'll mention that again. So, Dr. Goldstein, how did you become a chiropractor?
You know, it's very interesting. I come from 2 generations of pharmacists, so medicine was kind of like candy to us. Dad, I have a headache. Back then we took real aspirin. My stomach hurts. We had Pepto-Bismol. I had allergies, so I was taking nose drops and antihistamines every day. Growing up, I had the typical recurrent ear infections, recurrent sore throats, on antibiotics at least 3 or 4 times a year. By the time I was 12, I developed stomach problems, very intense stomach cramping. Went to the pediatrician who recommended mineral oil and sent me to a gastroenterologist who prescribed medication after doing a full GI test. And the medication decreased the secretions of normal digestive enzymes. So my mouth was always dry. After a year of that, went to another gastroenterologist, more medications. And at 12 years old, believe it or not, I sneezed and threw my back out, as they say. Went to the hospital, saw an orthopedist. A year later, my back was still bothering me, saw another orthopedist. So I had seen 5 medical doctors, and on a good day, I was taking about 4 to 5 drugs a day, and I wasn't getting any better. At 16, I threw my back out again, and my girlfriend's sister said, "Why don't you go see my chiropractor?" I never heard of a chiropractor. My parents said, "What do you have to lose?" And he explained the philosophy of chiropractic. And he explained that when bones move out of alignment, what we know as pinched nerves, what chiropractors call subluxations, they can cause pain, headaches. He said all of your symptoms are due to those bones, those subluxations in your spine. Well, I really didn't believe it. I figured I'm here for my back. And within 3 months, all my medication was in the garbage. No longer had the allergies or the stomach problems. And I said to my parents, I got to be a chiropractor. And so that's why I'm here today.
So you got inspired. Isn't it amazing with all those allergies and gastrointestinal symptoms that you explained that you had? No one ever looked at, what are you eating?
Oh, no, they did. And, you know, they told me not to eat spicy food. I mean, as a teenager, telling me not to eat nacho chips, not to eat pizza, that's your life as a teenager. So they did talk about the food, but it didn't matter. I still, even though if I limited my diet, I still had terrible cramping. And
then what happened when you started the chiropractic treatment?
Well, the interesting thing is as my symptoms abated, we were 18, and 18 we were allowed to drink.
Oh, that's right.
Yeah.
We were. I remember those years.
Went into the city with some friends to hear a musician, went to the Lone Star Cafe, and I had Firehouse chili and a beer. Normally, that would have doubled me over in stomach pains, and I was fine. So I was able to eat whatever I wanted. Not that I recommend having Firehouse chili and beer to my patients, but I was able to eat whatever I wanted without having to take any drugs.
So you noticed the difference right away from the time you were getting the adjustments.
Absolutely.
Yeah, chiropractic is amazing that way, because explain the philosophy of taking the pressure, I guess, off some of those nerves through adjusting, but you can't just do it on your own.
No, I even have to see a chiropractor. Patients will tell me, I can turn my head and I hear a snapping or popping noise. And I say, well, that's not correcting the problem, because if it was, I wouldn't have to go to my chiropractor. But what happens is through stress, and it's not just emotional stress, it could be physical or chemical stress, the muscles of the spine tighten. They pull bones out of their normal alignment, putting pressure on the nerves, on the discs, on the joints. And that can cause any type of, from pain to any type of systemic problems like headaches, migraine headaches, digestive problems, acid reflux, menstrual problems. So what we do is through a chiropractic analysis, we determine which bones are out of alignment, which is putting pressure on the nerve. And by the way, the pressure is not like it's squeezing on the nerve. It's just the pressure of one thin dime that can cause a disruption in the body's function. So once we see where those problems are occurring using my hands or sometimes instruments, we give a gentle adjustment to what we call an adjustment to that spine, taking the pressure off the nerve and allowing the nerve system to express itself so that the body can heal naturally and normally.
And I have to say, I personally have had chiropractics always. I mean, since I was a young girl also, and even to this day. In fact, I don't wait till there's a problem. I actually go regularly, once a week, in fact, for just a minor adjustment. How do you feel about that, like having it as a preventative rather than just something to treat a problem that's already there?
By the time the problem comes, it's been brewing there for a very long time. It could be years or even decades. And if the spine is out of alignment, that can cause arthritis. It can lead to herniated discs. So like you mentioned, I say to treat from the womb to the tomb. My son got his first adjustment when he was only 5 hours old, and it is a very gentle adjustment. As a matter of fact, I've treated infants with colic, and we have a huge success rate with colicky babies. One woman brought her daughter in, and after the first adjustment, she brought the daughter back for a second treatment, and she says, I don't know what you did, but I know you switched babies on me. Because she said, for the first time, my daughter slept 4 hours through the night. So we have tremendous results doing that.
Well, I want all you listeners to know, thank you so much for joining us today, right here on Herbally Yours, on the voice of Nassau Community College, 90.3 WHPC. And my guest, who's in-house here for the first time we've done this, actually live on Facebook Live here at WHPC, is Dr. Stephen Goldberg, a chiropractor who's local. He didn't fly in from England, like our guests are often international, but he's right here in Lynbrook, New York. So you can call him. You can call him at 516-887-1001 or go to his website, goldspinechiropractic.com. That's a good name, Gold Spine Chiropractic, since you're Dr. Goldstein. So that fits together really well. So also, let's talk about some of these techniques that you use, Dr. Goldstein. Like, for instance, what is applied kinesiology and what is advanced allergy therapeutics?
Well, we actually use applied kinesiology to do advanced allergy therapeutics, which is shortly it's AAT. And how I got involved in that is I had a persistent cough for 12 years that would last about 6 months. The cough was so deep and strong that I couldn't speak more than 3 or 4 words without hacking. And to talk to my patients, I would have to suck on Ricola drops just to get me through the day to talk to them. I had tried many different therapies with very little to no success. And I got an email about this treatment and went down to Florida to study it. And they found while I was there, I was coughing up lung tissue, so to speak. It was very deep. And they found that I was highly allergic to dust and dust mites. So they gave me a treatment down there, and on the plane ride back, my associate said to me, "You realize your cough is 80% better." So we started treating patients with all types of allergies. I had one woman who was Italian, and I mentioned that for a reason.
Lots of pasta.
Lots of pasta. So she was allergic to wheat. She was allergic to tomatoes. She was allergic to dairy. So she couldn't eat.
Pizza. Yeah. Yikes.
No pizza.
Right.
No lasagna. She came in and we started treating her, and she called me up one day and she said she was able to eat a slice of pizza for the first time in 20 years.
Without having a reaction.
Without having any reaction. So what an allergy is, it's an error message that the body got. And let me be specific, we're not talking about anaphylaxis. So the body gets this error message through some type of stress, emotional, chemical, physical. And all of a sudden, harmless substances the body is having a reaction to. So we hook
when we say harmless, it might be harmless to someone else, but that person's having a reaction to it.
Right. So when I say harmless, I mean like dust, pollen. We shouldn't be having reactions to these things. So we hook the patient up to a computer, and using applied kinesiology, which is muscle testing, we actually are asking the body what substance is aggravating them. And then through a gentle technique, we stimulate different nerve bundles and acupuncture meridians along the spine, basically telling the body you don't have to have a reaction to this. And they get better in about 4 to 14 visits, depending on what's going on with the patient.
So you're sort of re-educating the nervous system.
Absolutely.
To not react to something that it has sort of memorized a negative reaction to.
Absolutely.
It's amazing. I have experienced that myself. And what are some of the possible, let's say, side effects of having that kind of therapy done?
The biggest side effect is nothing's going to happen. They're not going to get any worse. They're only going to get better.
So the biggest side effect is it might not be effective, but it's not like a pharmaceutical,
right.
To your honoring your family's history of pharmaceuticals, where it may help, and it usually helps somewhat in quelling the symptoms, but there's a long list of adverse effects that often do come with that.
Yeah, with this, there's no adverse effect. We have over a 90% success rate. When you compare that to allergy shots, the protocol is once a week for 5 years, and they have about a 40% success rate, and there's nothing they can do with food sensitivities where we can help food sensitivities.
I think that's wonderful, and I personally have to vouch for the fact that I have seen this work in probably thousands of patients in the many years I have been working in this field. And it's so helpful because by having people come and have this done, they feel better, which is very rewarding both for you and for them.
Yes, and it's needleless, it's painless, it's bloodless. As a matter of fact, most patients feel that the treatment tickles, and the kids usually laugh while we're doing the treatment.
And it's great that you can have that for the whole family, even for babies.
Yes.
So I want to remind you, listeners, that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio. For more information about today's guest or topic, send us an email. We love to get your emails at whpc@ncc.edu. And I'd like to put out the phone number because if anybody would like to call in today, Dr. Stephen, who's right here with us, Dr. Stephen Goldstein, or myself, Ellen Kamhi, the natural nurse, we'd be happy to take your questions. So you can call in. The call-in number is 516-572-7440. That's 516-572-7440. And if you call in, we'll try to take your call on air. No cursing, please, because we have a delay, and that just makes it a whole lot of work. We don't want to deal with that. Call in with clean questions. And Dr. Stephen, about another technique that you do right in Lynbrook. So is that nutrition response testing, or is that a little different from the advanced allergy therapeutics?
It's different from allergy therapeutics. And what we found over the years is more and more patients are very, very toxic. We live in a very toxic environment. There's 80,000 chemicals out there that we're exposed to. None of them have been tested to see if they can harm us in any way or cause cancer in any way. Roundup, which is made by Monsanto, has put 2.6 billion chemicals and toxins into our environment. So we're seeing patients with a very high toxic overload. And what the nutritional response testing does is we get to see what toxins are in their body. We also get to see what deficiencies they have nutritionally so that we can heal their body better from the inside out. We look at their organ systems to see which organs are stressed, and we've had tremendous results with this technique.
So when you say look at their system nutritionally, explain that a little further. Like you evaluate their diet, or you can actually look at what things they might be missing.
Well, one thing we do when we do an evaluation is we hook them up to a heart rate variability monitor. Again, this is non-invasive. And what this does is it shows us what's going on in their nerve system. Their nerve system, of course, controls every single function of their body. And sometimes the nerve system gets a little confused as to what's going on. And when that nerve system is in a state of confusion, the body can't heal. So the first thing we do is we look at that. Then we test them using the applied kinesiology to see if there's any type of chemical problem, heavy metal problem, an immune challenge, or a food sensitivity. We even check to see if their scars might be interfering with their body. And then determining what's going on, we then test to see what nutritional products will help them to heal.
So then you would recommend, let's say, if they're low in magnesium, according to your testing, would you suggest they take magnesium, or they eat foods that have a higher magnesium, or how would you rectify that situation?
Well, one of the products we use is a standard process, and it's organic foods that they put into tablet form. So it's very, very concentrated. As you know, unfortunately, our soils are depleted. The apple that Grandma and Grandpa ate years ago that had all its nutrients, to get the same nutrients for us, we'd probably have to eat at least 6 or a dozen apples. So although it's great to get the minerals and nutrients they need from food today, the amount of food they would have to eat in order to get the proper amount would almost be impossible. So it's a lot easier to get it in the form of those pills. But at the same time, we do look at their diet and help them to clear up their diet as far as eliminating sugars, getting rid of the abundance of carbohydrates that most of us are eating. So we look to eliminate some of that on a short basis, little by little, not all or nothing.
So you make it non-challenging and something that people might be willing to try. Especially what I find also with clients is if they try something and it helps, that opens the door to being excited about doing other things that might also help.
Absolutely.
And you get out of that cycle of eating incorrectly, not exercising, and feeling crummy to, wow, I feel better. I'm out of pain, so now I can make better decisions.
Absolutely.
So that number, if you'd like to call in, is 572-7440 if you're in our area, or 516-572-7440 if you're not right here on Long Island. And we're here in Long Island, right here in WHPC at Nassau Community College, Garden City, New York. That's where we bring you this show from. And we're here today talking with our guest, Dr. Stephen Goldstein. His contact information is goldspinechiropractics.com, and his phone number is 516-887-1001. So we talked about a couple of very interesting things that you do. I think it's really very enlightening to people that it's not just putting hands on your spine, because I think chiropractors are thought of that way sometimes as just a bone cracker. And you've described so many other techniques that you might incorporate, and that it's really what we would call very holistic, and also not focused on just one age group. So what are some of the other things? Like, for instance, my own grandson is autistic. Unfortunately, the number of autistic children is just amazing.
It's sad.
It is. And so he has special needs. That's the groovy word for that now. So how would you address some of those issues with those kind of children? And do you have children like that in your practice?
We've been treating those children with the advanced allergy therapeutics because usually their digestive systems are all messed up. And we've helped that way. Before we did not have the nutritional response testing at that time that we were doing that. Now that we have that, one of the things that autistic children that we find is that they're suffering with heavy metal toxicity. And so we have to eliminate the heavy metal toxicity, which we do nutritionally. That's very important. We also want to see what organ systems are being stressed and how we can help those organ systems to heal and function better. So it's a long road, but it's something that we can help and something that we can look at.
I've also noticed with my own autistic grandson is that when he's had chiropractic adjustments and nutritional therapies, it's actually helped his oversensitivity to light. Like if you took him to a birthday party at one of these places with his flashing lights, that wasn't good for him.
Right.
And he really would just bend down and cover his ears and not be happy being there. And it seemed to increase his, or decrease his sensitivity, his oversensitivity to things like that, which was just great.
Well, I've had that with other patients, and the way I explain it to them is their nerve system is being irritated. It would kind of be like if I started to tap on your shoulder nonstop. Well, after a couple of seconds, you kind of like cut it out. After 5 minutes, you'd be a little more verbal at cutting it out. And eventually you might threaten to hit me with something. So their nerve systems are in a high state of irritability. And as we adjust them chiropractically, it calms the nerve system down a little bit for them so they're not as irritable. Patients have told me this with their children who were not autistic, who just might have temper tantrums, typical 2-year-old temper tantrums. And after we started adjusting them, the mothers will come in and say, he or she hasn't had any temper tantrums since you've been adjusting them. So it takes that irritability off the nerve system.
So more of that support for chiropractics as a family physician ongoingly, not instead of a pediatrician, but, you do such different things. And you're really looking at not just getting rid of pain, but certainly chiropractic is very famous for helping to get rid of pain. In fact, all the studies really show that it is the best therapy for something like lower back pain.
Absolutely. There's so many studies out there that verify what we chiropractors have been saying for well over 100 years on how we can get the body to function better. The scary thing is we make up 5% of the world's population. We take 60% of the world's drugs. There's over 7 billion people on the planet, and we're taking 60% of those drugs.
You mean by us? You mean by Americans?
By Americans, yes. And as far as how healthy a nation we are, according to the World Health Organization, I believe we're 34. So there's 33 nations healthier than us. They're taking less drugs. So drugs are not the answer. And people today want to look for alternatives rather than just popping pills all the time.
Well, how I look at it from the perspective of being a nurse is drugs are fantastic when used appropriately.
Yes.
I just think they're abused and overused because if we look at the adverse effect potential versus the healing potential, I would say we always go with something that is safer and effective first.
Yes.
And then, if necessary, move to a pharmaceutical therapeutic, which at times is necessary.
Absolutely.
But I just feel as a culture, they are being way overused and over-relied on and not effective. Where something gentle and mild like chiropractics, nutritional approaches, using supplements first, massage therapy, and meditation, which I know you've also taught,
yes,
is a much better way to go as primary and first step care. I'm really into making that happen while I'm still alive.
Absolutely. I mean, thank God for doctors, medical doctors. Thank God for hospitals.
And pharmacists.
And pharmacists. Sometimes drugs are necessary. Sometimes that is the answer. Other times, maybe drugs are needed to get a patient over the hump, and then they can go into more holistic type of treatments. So, I'm not saying to rule that out, but like you said, let's first try something that does not have any side effects and see if we can help patients that way.
Much, much better, way to go. And it's so great that you can be there for both children and adults and elderly. Do you find that older people are in more pain? Does that usually happen, or is it like working people?
I'm finding that senior citizens tend to be in more pain. They come into my office sometimes and say it doesn't pay to get old. And I always respond, don't tell me that, I have nothing to look forward to. So, they've gone through a lot. They're very toxic, being exposed to God knows what. A lot of them come into my office. They're taking 9 prescription drugs a day, let alone what they're taking over the counter. So sometimes those drugs might be necessary, but there are so many things we can do to help them to gain their health back. And so we try to work with them that way.
Another really great thing is with chiropractics, you don't have to worry about herb-drug interactions. Like, let's say you're on a lot of pharmaceuticals. Mm-hmm. That doesn't mean you can't get chiropractics.
Right.
Well, maybe you shouldn't take a whole handfuls of herbs and supplements without knowing what's going to react with the pharmaceuticals.
Right.
So it's really... you're not ingesting it, so it's really safe to start out with, and I think a great choice. It really gives people so much relief.
Yeah, and some of our elderly patients have osteoporosis, so the treatments that we give are very gentle. I don't have to worry about anything as far as that's concerned, and depending on the patient will depend on what treatments we're going to use.
Well, that was wonderful information, and I know very often even Medicare will cover chiropractic.
Yes.
So that's really great for us seniors like me. That's what I do. So it's really, really a beautiful, holistic kind of intervention that's safe, that's available, and that can be used by anybody in any time of life.
From the womb to the tomb.
Right. Did you make that up?
No, I did not.
That's a good saying. But we're actually coming close to the end of our show, Dr. Goldstein. So could you please tell people again where they might get in touch with you?
You can call me on my phone number, 516-887-1001. I'm located at 215 Atlantic Avenue, Suite A in Lynbrook, and our website is goldspinechiropractic.com. I'm also offering a free consultation if anyone's interested in finding out more about what we do.
That's great. Just give him a call and remind him that you heard him right here on WHPC. And thank you, listeners, for tuning into Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi, the Natural Nurse at naturalnurse.com. You can always give us an email, too, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.